As a C-section mom, you have just been discharged from the hospital, taking care of your baby, struggling through pain, through your recovery process. Everything just looks weird. So many things, so many questions may be running through your mind. And the commonest I always hear is, doctor, when is this pain going to end? How long will this pain last? Some mothers also ask, why is it that one side of my incision pains me more than the other? Some may even be asking, why am I having pulling, tightening around my incision area? Other questions may be, why is my scar now itching me? Why is it that when I touch my scar, the areas of my scar, I don't even feel anything? It feels strange. This pain, this is 3 months, 6 months, 1 year after my cesarean section. Why am I still having pain? So in this video, we are going to address these questions one by one. Because as a mom who has passed through cesarean recovery, I understand how confusing this stage can be. Hi, I'm Dr. EC, and on this platform, I share practical and evidence-based medical information to help you recover safely after delivery, as well as prepare you for labor and build a healthier home. Now let's look at this issue, pain after cesarean section. After the cesarean section, by the time you have now fully recovered from the anesthesia, that is when you now start noticing that, oh, I'm feeling pain here, I'm having pain there. Even to try coughing, to sneeze, to laugh will be, I don't know, it will be such a hair. It's not funny. It's so tormenting. You want to turn, cannot. You want to carry your baby, the pain will be so terrible. Yes, I know hospital will give you pain relief, but that pain relief doesn't last beyond certain number of days. Now, here comes the question. When will this pain stop? How long will this pain continue? My dear, there is no exact date, timeline that it's okay, this is cesarean section pain is supposed to last, supposed to stop. What I need to tell you is that it's expected to get better with time. Even in 2 weeks after your delivery, 3 weeks, 1 month after your cesarean section, you may still be feeling pain. But the good thing, or what you need to watch out for, is that this pain is not expected to get worse with time. It's expected to become better. You are expected to be, coping with the pain, become more comfortable with the pain, and not getting worse. So if as you heal, as the recovery progresses, your pain, rather than reducing, improving, is now getting worse. Yes, that is something you shouldn't joke with. That is something you should not ignore. It calls for medical evaluation. You need to seek medical care as soon as possible. Another question may be, oh, doctor, why am I now feeling so much pain on one side of my incision? Why is it happening? Honestly, this is more common than you think. Most mothers experience it. Here are the possible reasons why that happens. One, in some mothers during pregnancy, the uterus tend to shift to one side, just slightly tilted to one side of your body. So at surgery, that is where most of the work will be done. So that can explain it. Secondly, the side of your body that has the knot, where your surgeon, tied the knot, what was used to suture you, may be more painful. Also, depending on your dependent hand, for instance, if you are right-handed, there's every tendency that anytime you are moving, you will move more with your right part of your body. If you want to lie down, you may lie more on your right. You want to move, you may move. It depends on your dependent hand. Because the more you move that side, the more you disturb the healing, and that may explain why you will have more pain there. But this is not to say that we should normalize every one-sided pain. No. If the pain is becoming worse, it's something you can no longer bear, it's disturbing your sleep, it's disturbing your comfort, your sleep, your movement, please report back. But it's expected that as you recover and as you heal, the pain will gradually subside. Okay, now let's look at the next question. Why am I having tightness, pulling sensation over my scar. This happens because as you are healing, the area that was cut form scar. That as the scar is forming is tightening up. So that tightening, that contraction that happens as you heal explains why you may have such feeling. You may be having tightness, pulling, and that is why we encourage you that as your wound is healing, especially at that early period, in your first 6 weeks, in your first 3 months, do not disturb the healing. That is not the time to start doing hefty exercises, carrying hefty loads, doing very strenuous activity. We expect you to always be gentle to yourself in order not to disturb that natural healing and put more pressure on what is already going on. So if that tightness, the pulling, is also not getting better as you recover, my dear, is something that you shouldn't ignore. Another question may be, why is it that my scar is now itching me? It's been terrible. The itch is terrible. I experienced that. It could be very frustrating, honestly. My dear, it's also part of the normal phenomenon that take place while you are recovering in most mothers. So that itching is part of recovery. But sometimes it could be very annoying, honestly. But I want to appeal to you, don't be tempted to scratch it. Especially if your scar is still tender. In short, don't be tempted to scratch it, because in attempt to scratch it, you may just cause wound over there. So try to tap it, tap it, maybe, rub over it. You can get a cold compress, put over the place that is itching you. You can wrap ice. Don't put ice directly on the wound, please. Just wrap it. Make sure you wrap it and use it to tap that place. Okay? With time, that is also expected to improve. This is another one. Why am I feeling weird? The sensation over my scar, just above my scar, my lower abdomen is so weird. Sometimes I don't even feel it. When I touch it, it feels it's not part of my body, and sometimes it feels as though there is gritty sensation and tingling. Why does it happen? This happens because while you were having your surgery, the cut that was made cut through nerves, and nerves are just like the electrical wires of the body. They are what gives sensation, what makes you and I to feel sensation, to feel touch, to feel hot, to feel pain, to feel that something is cold, something is hot. Yes, the nerve sensation is what makes us feel that way. Now, as the surgery was done, there are some tiny nerves that were cut along the way. So now that you are healing, those nerves may be struggling to heal back. The areas where those nerves are still lacking may feel numb. The areas where those nerves are trying to come up may just have bizarre sensation, may have tingling sensation, exaggerated sensation over the area. So you need to also understand that it is part of your healing process. This is also expected to gradually improve with time, but sometimes it may take a very long time for that place to feel normal again. We've answered a lot of questions, from when will the pain end, to why is one side of your body paining you more, why are you having tightness and pulling sensation, why is there itchiness over there, why are you feeling numb or strange sensation over your incision area. Now, the next one is, why am I still feeling pain months, years after my cesarean section, when it is expected that it gets better with time? Yes, I understand that. Honestly, if you are having pain beyond 6 weeks, beyond 3 months, it's something you shouldn't ignore. Especially the pains that disturbs your sleep, disturbs your daily activity, makes you cry, it's something you should not ignore. It's something that you should report back to the hospital. But I also want to let you know that pain may linger. Pain may continue for some. What we are not expecting to see is that this pain is not getting worse. At 3 months, 6 months, 1 year, when you touch that incision area, you may feel pain. When you're trying to exercise, you may feel pain because recovery takes time. It's not just in 6 weeks, it's not for 3 months. Where it becomes an issue is when this pain is now affecting your daily activity. When you rest, the pain is still there. When you try to make yourself comfortable, the pain is still there. So that is when you should not just ignore. Now, these are the things I want you to be doing at home. Number 1, please remember that you had a surgery, because most mothers do not understand that they had surgery. Don't compare your healing to another person's healing, even if the person also had cesarean section. Your healing is unique to you. So you have to give yourself the time to heal and recover. Secondly, make sure you are resting. Rest. Even if nobody is there to help, pick the ones you can do comfortably, and don't choke yourself with every activities because nobody is there with you. Pick what you can do and create time for your own rest, because it is part of your recovery. Make sure you are taking your medications, especially if you are still within that window. You are newly discharged. You may have been given pain relief. Try and take them. Or you have gone to a report at the hospital and you were prescribed pain relief. Take them. So take your medications. Okay. Then when you want to cough, if you're having cough or you want to sneeze, or you want to laugh, always have a pillow by your side, a small pillow, so that when you want to laugh or sneeze or cough, you just put the pillow on use it to support yourself. Even when you want to sit out of the bed, you can also use it to support yourself. And if you are within 6 weeks of your recovery, I will advise you to get an abdominal binder and wear it correctly. The essence of the abdominal binder is for comfort and your support, and not for flat tummy. Get it? If you are beyond 6 weeks, abdominal wrap can be useful, can be helpful at this time. Please, it is not a girdle. There is difference between an abdominal wrap and a girdle. There's difference between an abdominal wrap and a corset. There's difference between an abdominal wrap and a body shaper. Please, it's neither of them. It is not a shaper. It is not a girdle. It is not a corset. So you wear it as it is. It's a wrap. Okay? Now, these are the things you should watch out for. Number 1, if the pain starts increasing, go to the hospital. If the incision, after it has healed, your scar is already formed, and you start noticing swellings, or it's changing color, or it's now opening up, please go to the hospital. Or you notice that it is not discharging, bringing out pus, please go to the hospital. Or you notice a swelling either along the incision or just above the incision, go and get evaluated. Don't sit at home thinking what you need to do, how you want to do it. Please go to the hospital, call your doctor, however you want to get there, go to the hospital and get examined properly. Okay, don't ignore this. Okay, if I want to repeat them, when the pain is increasing, if it's bringing out pus, is discharging, or there's a swelling of any kind along the incision, just above the incision, please do not ignore. Or you notice anything abnormal that is not relieving with time, please go to the hospital. Okay, I hope this helps you. Please do well to share with other mothers. And remember to like the video. It's one of the ways to tell the platform, the algorithm, that this video is valuable, and also to encourage me to do videos like this. And if you are yet to follow or subscribe, follow and subscribe for more postpartum recovery, family health, ENT health. And then I'll see you in the next one. Bye.